Memorial Health System provides compassionate, patient-centered care with some of the most advanced technology and treatment options available in healthcare today. We proudly present Memorial Health Radio. Here's Melanie Cole.
We all know that a sunburn can be very painful, but that's not the most important reason for using sunscreen, and there's a lot you can do to protect yourself and your family from skin cancer. My guest today is Amy Albrecht. She's a physician assistant at Strecker Cancer Center of Memorial Health System. Amy, tell us a little bit about the sun and how damaging it can be to our skin. Since you work at a cancer center, you must see skin cancer all the time. Tell us how damaging it can be.
We do see skin cancer at the cancer center. Protecting your skin from the sun is important for the prevention of skin cancer. Most skin cancers are associated with ultraviolet radiation. UV radiation comes from the sun and also from indoor tanning beds. UVA rays cause aging of our skin cells and can lead to long-term damage like wrinkles. And UVB rays damage the DNA in our skin cells. These are the rays most likely to cause sunburns and may lead to skin cancer.
So we hear we're supposed to use sunscreen, which not everybody always does. Tell us a little bit about sunscreen. There's so many of them on the market. What are we supposed to be looking for?
Sunscreens help to block the UV rays from reaching our skin. They're measured using sun protection factor, or SPF. You want to find a sunscreen that is broad spectrum, which means it protects from the UVA and UVB rays. Look for a sunscreen with SPF 15 or higher. Make sure you apply 30 minutes before sun exposure and reapply every 2 hours or after sweating or swimming.
So what about little infants and such? Can we put sunscreen on them, and what should we be doing to protect them from the sun?
Infant skin is very sensitive. It's best during the first 6 months to avoid direct sun exposure and keep the infant in the shade. If the baby must be in the sun, you want to dress in clothing that covers the body and shadow the face with a wide brim hat. Children 6 months and older should wear sunscreen SPF 30 or greater. Try to escape the sun by using an umbrella or a tent. Make sure your child is wearing sunscreen and that it's reapplied often. Even on a cloudy or overcast day, we are exposed.
So you mentioned number 15. People go all the way up to 70 and things like that. Does more equal better protection?
The higher the number, the better you would be protected from the sun. So 15 is just the lowest number that you should get, but you're right, you can get all the way up to 50 or 100. So just make sure it's over 15.
So if we're checking our skin for skin cancer, and if we used to be in the sun and now we know better, what are we looking for?
Checking your skin is important, and you should try to do it monthly. And if you were to find something suspicious, I want you to see your primary care provider or dermatology. You're looking for the A, B, C, D, E's of melanoma. So A is asymmetry. Do the sides of the mole match? If you were to draw a line down the center, do the halves look similar? Asymmetry is a warning sign that it could be a cancer. B stands for border. Are the borders of the mole smooth and regular? If the edges look uneven or irregular, you should really have the mole evaluated by a health professional. C is color. A normal mole should be one shade. If there are a variety of shades, that can be another warning sign. D is diameter. Look for moles that are bigger than a pencil eraser. Those can be more concerning. Evolution is E, and that is the mole changing over time. Has this looked the same your whole life, or all of a sudden are there changes?
That's really great advice. So you work in a cancer center, and you must see skin cancer all the time. As I said before, what is the most damaging kind?
There are three main types of skin cancer. There are other types, but three main types. Melanoma is the most dangerous form of skin cancer. Basal cell carcinoma is the most common, and squamous cell carcinoma is the second most common.
So how do we know if we're protected from the sun, if we're using our sunscreen or wearing a hat and sunglasses? Is there a way to tell, does our skin show spots and things like that that can tell us that we're damaging it?
Well, that's why it's so important to keep an eye on the skin and do those monthly skin checks. But by preventing exposure to the sun, we can best protect our skin. Try to find some shade, especially between 10 a.m. and 4 p.m. Seek cover by wearing sun-protective clothing. Protect your face and your eyes with a wide brim hat and sunglasses. Sunscreen is a great defense. Remember to wear SPF 15 or higher. And try to apply the sunscreen 30 minutes before going outdoors. It also needs to be reapplied. every 2 hours, or if you swim, sweat, towel off. And another important thing is to avoid tanning beds and sunbathing.
That's really important. Just wrap it up for us, Amy, with your best advice about safety in the sun and protecting ourselves from the cancers that you see every day.
It's important to seek shade, make sure you're wearing the protective clothing, including a wide brim hat, sunglasses. Use your sunscreen, make sure you reapply. Keep your newborns out of the sun, keep your kids out of the sun, and keep them safe. Avoid indoor tanning and sunbathing, and also make sure to examine your skin monthly.
That's great advice. Thank you, Amy, for being with us so much today. You're listening to Memorial Health Radio with Memorial Health System. For more information, please visit mhsystem.org. That's mhsystem.org. This is Melanie Cole. Thanks so much for listening.